I'm Andrea Flores. The state may be reopening, but COVID-19 is still impacting all of us. That's why every week right here on CBSN Denver, we get your coronavirus questions answered by a doctor during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, it seems every week we're hearing about more places offering antibody testing, but the CDC warns overall accuracy is 50%. What steps can people take to get the most accurate test possible?
Yeah, accuracy really is a huge issue right now with these tests to determine if you have antibodies to coronavirus. More than 100 companies are producing these tests, and there's a big difference in terms of accuracy. So the first question you ask is, well, how do I get an accurate test? Well, what you want is that test being done through a blood draw. In other words, a tube of blood being taken from you, just like if you'd go in for any other blood test. What you don't want is a rapid test. Those have not been approved by the FDA, nor do you want to have a saliva test, or do you want to have something that is done through a finger stick. Those have not been approved either. So you say, well, where can I go to get an accurate test? I think that most major hospitals are very reliable when it comes to their testing. UC Health, for example, their test is considered 97% accurate. So we're good there. Major hospital systems is a good place to utilize. Also, the commercial labs here in Colorado, Quest, LabCorp, very good. And then you take a look at if you wind up going to your doctor or you wind up going to urgent care, or even your employer wants to do testing on you. I think really what you need to ask is the question, how accurate is this test? And the answer is not, well, it's an accurate test. You want to know what that number is.
And Dr. Dave, last week, the governor allowed restaurants to reopen. What is your reaction to the restrictions put in place for those businesses?
I think that actually the plan is a very good one, and that is provided that the restaurant as well as patrons really wind up following the plan that is in place. So when you go to a restaurant, really what you want to see is you don't want to see a crowd of people mingling together waiting to get in. There should be spacing if there is a wait time. And then when you go inside, you want to make sure that the staff, particularly wait staff, they're wearing masks. You should see what you would think of as a spacious type of restaurant, not the typical crowded, jammed together type of place that you're probably used to. You want to make sure that people are not freely moving about, that people, when they are at a table, they're not commingling, they're not walking around frequently. You also would like to go somewhere that has fresh air coming into the location. Fresh air is considered to be a very big part of protection from coronavirus. Now, that doesn't necessarily mean running a fan or running an air conditioner, because we've actually found that that does not really disperse. Instead, it can spread coronavirus particles. And then think about the fact that if you are asked about giving your name and phone number for contact tracing, if necessary, that's always a good idea. Hopefully this plan is going to work out well.
As more businesses reopen, many people may think that there's no longer a need to wear a mask or social distance. What's your message to people who may think that all of this is over?
I mean, let's face it, we all have some level of quarantine fatigue, and we really want to get out and get moving again. But on the other hand, what you need to think about are the three dynamics that got us to the point where we are able to reopen, and that is social distancing. Colorado is considered to be one of the top 5 states when it comes to social distancing. And then you take a look at the use of masks. Colorado, 80% of people consistently wear masks. So, you're doing it for the community. You're not necessarily doing it for yourself. So please consider that. And then there's a matter of hygiene. So if you're looking forward to things continuing to reopen, being able to go back to work, schools reopening, being able to go to a ball game, Remember the three dynamics. That's what has gotten us here, and that's what will keep us moving forward.
Thank you, Dr. Dave, for all of that helpful information. We will see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just head to cbsdenver.com. We'll be right back.